Thank you, Honorable President Shaid, as well as Honorable President Kelapile, Honorable Ms. Mohammed, and my compatriot, Winnie Byanyima, Dr. Fauci, and other honorable keynote speakers. Thank you for this opportunity to speak on ending inequalities for adolescents and young people in the HIV response. We have made significant progress in the global AIDS response since the last political declaration in 2016. But there is still so much work to do, especially for adolescents and young people. The COVID-19 pandemic has exacerbated some of the challenges in accessing HIV services and exposed inequalities and gaps in service delivery. Many reporting countries have documented massive service disruptions, resulting in new treatment initiations for children under the age of 14, falling up to 50%. In 2020, the antiretroviral treatment coverage among adolescents with HIV was just over 50% globally, with the lowest access in West and Central Africa at 43% and the highest in South Asia at 61%. This is not nearly good enough. HIV awareness among adolescents remains unacceptably low. In most countries, their comprehensive knowledge of HIV is below 50%. We must do better. For starters, we can be more innovative in how we engage adolescents and young people. UNICEF's U-Test project in Côte d'Ivoire, supported by the Elton John AIDS Foundation, is a good case study of innovation in action. The project combines digital social networking with offline outreach to optimize HIV self-testing among at-risk adolescents and young people. U-Test leverages the U-Report messaging and engagement platform for adolescent, youth, and community participation. Since its inception 2 years ago, U-Test has trained 158 health and community health workers and reached almost 24,000 adolescents and young people with combined HIV prevention services. We must also strengthen mental health support for adolescents and young people living with HIV, focused on challenges linked to isolation and marginalization. This is especially critical now, given quarantine and movement restrictions linked to COVID-19 pandemic. Next, we should support the engagement of adolescents and young people as key actors in both local and global HIV responses. Peer interventions, for example, remain some of the most highly successful programs targeting young people. With support from the Swedish International Development Cooperation Agency, UNICEF in Zimbabwe supports a young mentor-mother peer support program where young trained mentor mothers living with HIV provide holistic and personalized counseling, education, and psychosocial support to other young mothers. The impact is direct and powerful, providing a safe space for young mothers to make friends, ask questions, and gain support. And finally, we should expand services and support for vulnerable and marginalized groups. HIV infection in young people is driven largely by the dual epidemics of HIV among adolescent girls and young women, and in young marginalized populations, including adolescents exploited in sex work, young men who have sex with men, and young transgender people. Key populations of young people are at high risk of HIV due to rights violations, discrimination, exclusion, criminalization, and violence. HIV testing and prevention services are often poorly tailored to adolescent needs, values, and preferences. For adolescents and key populations, these deterrents are compounded by stigma and discrimination. We are making strides in providing HIV and other supportive services to children and young people most in need, yet we must do more to reach all those in the most marginalized groups, including and especially adolescent girls and young women. We look forward to the renewed commitment through both the new political declaration and the new global AIDS strategy to ensure that no adolescent or young person is left behind in the AIDS response. Thank you.